A specialty court dedicated to dealing only with the cases of nonviolent drug offenders is seen by many as a key to successfully attacking the opioid addiction crisis. While there are about 24 courts across the Commonwealth, there are few in Western Massachusetts and none in Hampden County. That's something District Attorney Anthony Gulluni wants to change, and he came in to tell us about his concerns.
I think it's finally coming to light, Jim, the depth and seriousness of this problem of opiate addiction in Hampden County. And we realize now through data and science and in many cases anecdotal experiences, this is a disease. And if I think finally government, the science community, the medical community, and others are coming to that realization. And what we know about this disease is that it doesn't go away easily. It's stubborn, unfortunately. So I think we in the criminal justice system, and in particular I as district attorney, have to deal with this problem. We're not necessarily equipped traditionally to deal with a public health crisis and to deal with a disease, but through virtue of how things work, the nature of this issue, it's often causing people to commit crime. They're coming into our system. So we have to deal with it. We have to be in a position where we can effectively deal with the core issue of addiction. And to have a drug court to be specialized around this issue and equip the trial court system, the district attorney's office, defense attorneys who are going to deal with these folks as clients, to deal with that core issue of addiction, to understand it, and to have treatment professionals in the nonprofit sector equipped and built into this drug court system, I think is going to be critical in getting ourselves out of this malaise. I believe that there's a law enforcement end where we have to be strict and very aggressive in prosecuting on people who are profiting from addiction. But those suffering from addiction, who are using drugs, who are caught with mere possession cases or cases like trespassing and shoplifting that are outgrowths of addiction, we have to put them in a place outside of the regular stream of criminal cases into a specialized court where the services are built in, they're provided, it's providing long-term care, and hopefully we don't see them again. And that's really, I think, what we're focused on, is getting these people well, solving the addiction riddle, and getting these people on and well and in more positive places in their lives.
So you definitely don't agree with the argument. We don't hear a lot, but you do hear people say, hey, if it's drug use, abuse, whatever sense, whatever way, we're not treating it straightforward in the criminal courts. It's coddling, it's letting people off easy, it's sending the wrong message, and it's spreading thin court resources even thinner than they are. You don't buy that.
I wouldn't agree with that. And I think here we have a unique situation where fiscal concerns align with humanitarian concerns. We have people who are suffering from an addiction. There's no question that there's some affirmative conduct that in some ways leads them to that. But it's an addiction. It's something in their DNA. It's something that they have to deal with, like many other things. So we believe that it's not only humanitarian, it's going to help people, but it's also going to make fiscal sense. I see this as a district attorney managing a budget, managing a staff. If we get these people well, we get them into a drug court, get them the treatment that they need, that resolves that core issue, Jim, we don't see them back again. Right now, we're seeing people suffering from addiction come into the courthouse on small offenses. They're getting probation. They're getting, in some cases, very short periods of time in the House of Correction. They're paying fines. They're going out the door, but they're coming back in short order. So it doesn't make fiscal sense for those who would say this is coddling, this is irresponsible in a financial sense. We're using court resources that are so crucial and precious. This makes sense on a fiscal standpoint, and it also considers the science, the data, what we know about this disease, and also it's in a position where we can help people and get people well through their, in very many cases, worst point in their lives, coming into a criminal court session, presenting to a judge.
Now, in fairness to you, you're a year on the job, but how did it come to be that in Western Massachusetts, Greenfield's got a drug court, Orange got a drug court, Springfield, biggest jurisdiction in the region, did we not raise our hand quick enough? I'm not trying to be flip or silly about this, but what happened that we got left a little behind?
And I would mention, I think Springfield has a peculiar acute problem with addiction.
Mm-hmm. Yeah.
So there's a real need here for this kind of thing, and there's proven success around the state. So you can go west, you can go north, you can also go east, of course, and there are drug courts all over the Boston area and the eastern part of the state. So it was one of the things I identified as just an anomaly. We've got to get a drug court here. I began working with our local legislators to raise our hand and to send off some alarms to our folks in the legislature that we need this. So it's just one of those things that's hard to explain, but we're acting as swiftly as possible to correct that issue.
Let's talk about some of the timetable as best you know it. Talk last fall was that they hoped by spring of this year, 2016. Now, granted, we're coming up on spring. It'll be a few weeks. But in that 3-month period, roughly, to early summer, to actually get it going. Is there a sense that that could happen?
It could happen. I would hazard a guess that it's probably going to be a little bit further out into the summer. I think the trial court is working on it. The money's been allocated by the legislature. The trial court is getting its ducks in a row, so to speak, and we're here to partner and to help and to advise as much as we possibly can. But we're ready, willing, and the need is very serious.
There's going to need to be some additional personnel, particularly in the area of probation. That's going to cost some money. Correct me if I'm wrong. I believe in the current year budget, 2016, there was $500,000 to start getting a drug court going in Springfield. It ended up out of the final budget. We know this year is tight again. It's going to be a fight. That's part of what you're waiting for, I gather, seeing what happens with the budget that'll take effect end of the current fiscal year, which would be July 1st. So this is a critical time, isn't it? This is push and shove time now.
There's no question, and I've had conversations with the Speaker of the House, who was very sensitive to this issue, was very aware of it, and knows of the need now here in Western Massachusetts. We're very hopeful the money's going to be there. We're very hopeful that the understanding around how much money is needed is there for the trial court. You mentioned the probation department, no question, but all facets of this, and it has to be equipped with the services provided by the nonprofit sector. People can provide the care and the treatment for people suffering from addiction.
A lot of pieces in this puzzle have to come together, but if I understand what you've said so far, and please feel free to correct me, if this happens, you feel many people you see in and out of the courts now, you won't see coming back again and again, and that results in tax dollar. You're getting less prison time for people, fewer continued arrests, less recidivism, and really a change in lives. That's your thought, that's your goal?
That's certainly the hope. I think we do a very good job in the court system now at identifying people dealing with addiction and giving them the treatment through probation services and so forth. But this is going to be a much more thought out, strategic, and comprehensive plan having a drug court. So the thought is that, yes, the services will be provided, the resources will be there to back it up, there'll be long-term care and treatment, and the people who are in the throes of addiction will come out of that through this process and stop committing crimes. I think it's in the near term, it's going to cost some money. There's no question. But in the long term, the hope, the thought, the strategy is that we're going to save ourselves some money long term. That's really the key.
And it needs community support, community involvement, not just law enforcement. Your sense is that that's there, that's ready to kick in and make this work?
I believe so. I think there's an understanding around this issue that's new, that's developing, that's kind of followed the loudness of this narrative in the last few months, how widespread and serious the addiction issue is. So yeah, we need all the support we can get, and I think the support to our legislators, the support to leadership in Boston is important. But it's in the works. I'm confident it's going to happen, and I think it's going to reap rewards for us here in Hampden County.
It's always tough to ask somebody to guess what's going to happen on Beacon Hill, but a year from now we're sitting here, you're pretty confident there'll be a drug court going on in the county?
Yes.
District Attorney Anthony Gulluni, thanks for coming in. Thanks for your time, sir.
Thank you very much. Appreciate it.